Hi everyone, and welcome to my Facebook Live. I'm Dr. Sally Foote, and welcome. I'm going to just turn the camera here just a little bit because you're seeing all my clutter and I don't like that. There we go. Okay, sorry about that. So hi everybody. I want to first of all thank everyone who came to my aggressive, anxious dog and cat handling day and the live streaming seminar I did about a week and a half ago. We had really great turnout, great response. And it was really good using, I think, the GoToMeeting for the chat and a lot of good exchange as well as learning that day. So today I wanted to talk a little bit about like how can we get people to listen to us? And what we mean is, I consult, I do behavior consults for clients, and a lot of veterinary practices will refer to me. And I also, teach on less stressful handling, and how to make these handling plans and set up your practice for decreasing the fear and anxiety and aggression for our patients that come in for care. Veterinary practices, at shelters, lots of places. So a friend of mine, a recent local veterinarian, she and I were talking about an aggressive dog that was due to come in for care that also didn't sedate well to some of the oral cocktails. And we were talking about like not only the medication but the whole plan now that had to be outlined for this dog. And this dog had been rising, over time with its behavior to now where it was at a point where it was downright dangerous to handle. And she expressed her frustration about why is it that people won't listen to you? You're telling them when this dog is 4 months old, where you could see the dog is starting to they're hiding, they're shaking, you've given them the Adaptil, you've told them to come in for happy visits and they don't. They are like, he's fine, the owner may be saying that, and you're trying to say, no, he's not fine. This will become, this shaking or just a little bit of growling in a 4-month-old puppy will become a 150-pound Rottweiler that is lunging at me or my staff and is downright dangerous to care for. We don't want to go there. But people just don't listen. And then there we are, a year to 2 years later with a dog who is now lunging and trying to be aggressive. And then we're trying to work out these medication plans because there is no magic pill that's going to get these dogs, especially, that's going to be the focus today, a lot is on dogs anyway, or this cat also, to be less anxious. But that listening to the veterinarian, the veterinary technician, the trainer, the dog groomer, the shelter care workers as to, we see the brewing problem and it's gonna get this bad, that's where there's a disconnect. So I started thinking about that, and I thought a little bit of, okay, I was in practice for 35 years. How did I start to, find the way to get people to say these statements? How did I get some people to listen to me? I will tell you, first of all, not everyone will listen to you. Yeah, that's just kind of the tough stuff, is that not every person will follow your advice or will listen to you. So we should still give our advice. We should make our statements, because for some people it's going to take multiple times of saying something before they finally listen. For others, there might be one family member, in this home who will listen and now follow your advice or do the things you want them to do, despite the fact that others are not doing it. And even though there may only be one in the home who will say, come by for the happy visits, or agree to give, say, the anxiety reducing or sedating medication ahead of time, that's still worthwhile to try, because you may get that amount of breakthrough. But I thought I did a little research last night on, well, what gets people to listen? How do we really help like other people to understand when something is, I feel this is a really important message, a really important statement, and I want you to at least acknowledge that you heard it and you understand what it means. Whether or not you do it, that's out of my hands. I can't make you do anything, but I need to know that you are acknowledging or understanding what I'm trying to inform you about. It's about information. So I did a little reading last night, as I said, and I came across a good article by, it was actually, an entrepreneur in business. It was more about you know, come from the business side. How in business do you get other coworkers or as a boss, manager, people to listen to you? But it's all really the same thing. You know, what you learn in any kind of a communication or business course for people to listen to you, whether, or even in parenting, you know, parenting courses, it's still the same tactics, the same skills that you're going to use. Sorry. So, you know, the first thing is, okay, and I'm just going to give the examples, right? Client comes in, they've got the 3-month-old, you know, Rottweiler puppy who's a little scared, he's ducking, he's 12 weeks of age, and his first vet exam, so he's at that borderline of shifting into the fear period for dogs. We put the Adaptil on him, we've got the baby food, but he still is kind of timid and scared. There may be genetics going on here. Why this puppy is still somewhat timid despite giving him puppy food, using less stressful handling, giving him the Adaptil to help him calm down. And if I recognize or see that right away, or my technician does, and so we say, hey, this puppy, he's scared, but he is going to, if we don't start to do socialization now the right way, using lots of rewards, breaking this down into small steps, he will become more fearful, and this oftentimes can shift over to aggression as he gets older. And what do we hear from a lot of owners? Oh no, he's just a puppy, he'll grow out of it. Oh, it'll be fine. We know that's not true. So we've got somebody who they don't want to acknowledge, they don't want to take this information. So, you know, sometimes you might just say to yourself, okay, you don't want to listen to me now, we'll deal with the problem bigger later, like pay me now or pay me later. You know, I want you to spend $20 on a bottle of Adaptil and just for free come over at lunchtime, you know, like that's a low cost thing to do. You don't want to do it? Well, then we'll be spending a lot more money and time when I have to give them oral medication ahead of time before exams, or you're going to be calling in the private trainer because he can't go into puppy class. He's going to be too upset and too agitated. You know, some of you might, and you may even just say that statement right then. Pay me now or pay me later, or pay up now or you'll pay more later. And the idea being it's going to be little effort now and more later. And so that can be one way of kind of not letting yourself get too upset about it all. And some people will use a statement that way. But what we really want to say is there are about 5 steps here to help people to listen to you. Okay, so I'm going to go through those 5 steps that I learned from this article from a psychologist. If you're just not ready to go, well, told you once, I'm out of here, I got to do more work. Okay, so first of all, we want to stop chatter. If in that moment, okay, I'm going to go back to the example of the 12-week-old Rottweiler puppy who is, you know, still hiding and ducking and very fearful despite the low stress handling, the rewards, and the Adaptil. So we've done a lot in that moment right there to make it better, and I could clearly see this puppy is already having problems and they're going to get worse. So the first thing is stop chatter, meaning don't say a lot of words. You've got to keep very direct statements of what you need to say. And as a lot of you know who know me, I tend to be a very direct communicator. I say things very directly. And I'm going to say it out loud. There's a lot of women in the animal care professions. We have a majority of our graduates from veterinary school are veterinarians. The majority of our veterinary technicians, veterinary nurses are women. A lot of dog trainers are women. We may have a little bit of balance, male to female in that field, but still, we have a big representation of women. Dog groomers are women. Shelter care administrators, shelter care behaviorists, head caretakers, etc., volunteers tend to be a lot of women. So we have many women in this field. And many women get often when women communicate, we use a lot of words. We keep talking. We fill the background with chatter. So cut that short. Get straight to the point. And if you need to practice this with a friend, please do. So you're going to say some direct statements like, growls lead to bites. And you stay quiet. You say nothing more. When somebody says, oh, he's just growling, it's okay. Growls lead to bites. Okay, that's the first thing you're going to learn to do. Direct, simple statement. Another good statement for when the client may have said, oh, the dogs are they got in a tuffle, they got in a squabble over the food bowl again this morning. And they just say it offhandedly. And you're trying to explain why they shouldn't share a bowl and they should have separate bowls. And frankly, the client's eyes may gloss over because they just see it as a one-off, that the dogs had a fight. In that case, say, only humans want to share. And it's true. Okay, just say that. Only humans want to share. Stay silent. And they're going to look at you, and you caught their attention. And now you say, humans are the only species that want to bring their food together at a table and share it. That want to lay in a bed together and share that. That want to bring their toys to a group and share and play together. Dogs do not naturally do this. Cats do not naturally do this. That bowl on the floor, you're forcing them to share. That's why there's a fight. See, those are really direct, short statements. That's how you communicate that. So stop the chatter. Now, before you make the statement, listen to your client. If they made that statement, oh, he's just growling, it doesn't mean anything. Okay, and when you listen, you have to have the body language of listening. So listening means I'm going to look at you, I'm going to face forward and look at you, and I'm going to make eye contact. I will make eye contact. Now, it's not a stare down, but I'm going to look you in the eye, or I'm going to look at the person's forehead or the top of their head, just get my face oriented to them. So even if I'm doing the exam and listening to the stethoscope and I turn to write on the record and we heard the dog, that Rottweiler puppy, growl, because maybe the technician started to lift the puppy and the technician says, oh, we need to talk about this, and the client says, oh, that's just a growl, not a problem, I am going to turn around and face that client. I may not say anything in the moment, but in my turning around and facing that client, and I say, has he growled at other times? Silent. But I'm going to stay facing the client because they're going to need to answer back to me. And when they see me facing them, they know I'm listening to them. So now I've increased engagement between the two of us. So I show to them I'm listening to them. It's going to increase the likelihood that they're going to return the look back to me. So they'll be listening to me. It's all about human body language. So be aware of your body language. The second thing is you need to be confident as you listen, confident also as you speak. So the confidence is how do people tell you're confident? Do they tell you're confident by your posture? If you're sitting shoulders back, don't be sitting like this. Please don't sit like this, or sit like this, or be sitting slumped like this. The moment somebody says something, I need to tell them, and know that Rottweiler puppy is brewing with fear to become aggression. I'm going to sit up like this. I'm going to put my chin up. Practice this. Sit in front of a mirror at home. Video yourself. Because shifting to like this and saying, no, actually, a growl is a bite that hasn't connected yet. They're going to realize, ooh, my body paid attention and I'm confident in what I'm saying. Okay, so we need to show confidence in our body language. So this would be the sitting posture. The standing posture, if I was standing by my exam table, and I might have been, writing like this, and as soon as a person says it, I'm going to stand up just like this. See how I have my shoulders square and back? My body is upright. I'm facing forward to the client. And so you need to do this. Now, I'm not being aggressive, but I am saying, just heard what you had to say, and I feel I'm strong in my body, so I'm going to be strong. I'm going to be strong in my information. So practice or watch your own body language to reflect your confidence. And for women, need to practice this. I really see this in a lot of women, younger and older women, that they do not use that straight up posture. They don't face forward, and they don't hold their head up. They may be doing a lot of cocking of the head to the side, or holding their head down like this, or slumping like this. And if your body looks weak, then your message will be heard as weak, and that is not what you want. You want a strong message, at least getting out to the person. Information like infographics and handouts are a second layer, a second level of giving out this information. So again, let's go back to the Rottweiler puppy, right? He just growled or was hiding. He was hiding despite all this help during the exam. He gave a little growl as the technician picked him up to set him back on the floor. That's a touch of handling aggression. And I'm like, okay, we want to have this puppy do a lot better. So when that puppy just gave a quick little growl, I say, tell me, does he do this for anything else at home? And I'm silent. No more words. The client may say, oh yeah, he doesn't want the kids hug him on the couch, but it's no big deal. Okay, now he's growling, so he doesn't like being hugged, he doesn't like being handled and that. I'm just going to point to this handout that is hanging on my wall. This is why I have these handouts hanging on the wall in my examination room, in the waiting room. They need to be out so you can show these to clients right in the moment. So when I say, okay, a growl is going to go to a bite, and that's exactly how I would say it. Just those words, remember, no chatter. A growl will go to a bite. So now my finger is pointing to the handout, right, to the information graphic. So they're getting the visual. They're getting visual information and they're getting verbal information. This increases how much is going to be retained in their brain, at least for them to have heard the statement. So I keep this, like I said, keep it posted on the wall. Actually, I pair it. This is my first of my top 5 low stress handling techniques. I pair it with the body language poster. And then I had these handouts in a file box that was printed out already. We had plenty in folders in a little file box, that sat on a shelf in the exam room. So as I may have responded this way, and my technicians would do the same thing too. They would just say, well, that's what it means, as they pointed to the body language poster. Then the client, usually the client didn't object because now they're looking at this picture, And when they're looking at the picture, then because the file box was literally within his arm's reach, we would just walk over, the tech would walk over, immediately pull out 2 copies of this and write the name of the pet on the top of the handout. And this is going to be handed to the client. Okay, you hand this to the client in that moment because now this is then the second, exposure, if you will, giving them, you're literally giving them a second time of information, and you're handing it in their hands. When they hand it and they touch it in their hands, that also imprints on them that that's supposed to be pretty important. If you you gave me the handout at no charge, and you put my pet's name on the top. When you put the pet's name on the top of any handout at all, and this includes a medical one for like how to care for a wound or post-surgical care, people will read it because their pet's name is on it. It attracts them. So put the pet's name on it. Now we're going to hand these 2 to them and say, here you go, keep these. Please post those on your refrigerator. We want you to put it on your refrigerator so it's central in your home. Again, very direct, short statements. Say, now when you notice this, just stop whatever's going on around your dog. Okay, that's your simple starting point. So we have stop the chatter, we have confident body posture, and how your tone of voice is. Also, some handouts and information that are handy. Same thing for our kitty cats. I also had these 2, the feline letter of aggression hanging on the wall, the feline body language poster also hanging on the wall. So in that same moment, if someone said, oh, my cat's fine, he just hides under the bed all day when the kids are out, but he's calm and he's happy. No, he's not. He's a totally stressed out cat. And I would then just point to here, hiding is halfway up. He's spending his day stressed out all day. We need to get the commotion away around from him to go down here. Okay, and at the same thing, we'd hand out the 2 handouts to the client. Now, that worked, and I'll give you at the end kind of some of my statements. So these kind of statements like a growl is a bite that hasn't connected yet, and as I said that, I'll get my right hand out. As I said that, I would be pointing to a growl is going to a bite, or a growl is a bite that just hasn't connected yet. It's gonna, right? So this way they could understand that, or at least get what I'm saying. May not have changed everybody, but I used that statement, and it just kept popping in my head. So it was a quick thing to say in response to people when they would say things like, "Oh, he's just growling. It's okay." So a statement like that, keep the word short to maybe only 5 words as your response back. Really, 5 words is like the maximum in a statement, and then just stay silent. The last thing I guess I want to say too is that sometimes people need to see it or like experience something to know what will really happen, and that's what's really sad, right? Oh, he's just growling, it's not a big deal. Oh, he's just growling, it's not a big deal. And then the dog, because the dog has been warning every time the child has been hugging, the dog around the neck, and the dog is growling at the child. And the child won't quit hugging the dog because the child loves to hug the dog, then of course what happens is you're going to have the time when the dog bites the child in the face because the child is hugging the dog is growling, the dog is saying, I don't want you to do it, let me go. I don't want you to do it, let me go. And because the child does not let go, the threat is still there. The dog says, all I got left is to use my teeth, and so the dog bites. And so what happens is then the child's bitten on the face, and now the veterinarian is called or the trainer is called and said, the dog just bit my kid in the face. And so it didn't happen out of the blue. And now the dog has learned, I have to go to bite to make it stop. And so I started being much more graphic with my clients. I really was. Now, I would not use names. I would not give out any personal information, yet when I would have a parent like, oh, it's okay, the dog just growls and the kids hug him. I said, well, I just had a mother call me last week about the beautiful Labrador that chomped on her 2-year-old on the face. And they're like, oh my God, like a Labrador would bite? Yes, a Labrador would bite. Why? Because the 2-year-old kept hanging off of the dog's neck, hugging him, and the dog was growling, and the parents were ignoring him. So, and as I'm saying this, I'm pointing. This is why you have this on your wall, that you can easily point to it. I point to it, say, the dog was doing this. He was growling. You're saying, please get this child away. Nobody was. The child is 2 years old. He doesn't know. So then the dog does what a dog will do. The dog bit the child to make the child go away. Now the dog is going to pay the price. That's what they called me about. They called me about euthanasia. And this is exactly how I would say it. And then people would just be like stunned. I said, that's my world. And that's what people bring to me if you don't listen to my advice. And again, I would just stay silent. And I would say, and I've said this to many families, like, I don't want you ever to be in that situation. I don't want to be in that situation either. So here's what I'm telling you to do. And I would say those words. Here's what I am telling you to do. I'm not asking you to do. I'm telling you to do this so that your child doesn't end up in the emergency room with emergency plastic surgery on the face. And secondly, you are not in this big fight and dilemma in the home about euthanizing the dog or not, or what are we going to do now? And thirdly, now I have a dog in my care that will bite when people try to hug around the neck because that's been what he learned to do to make that stop. We can prevent all this. Let's do it. This is how I would make those statements. So sharing a story like that, I feel is important. I think about as a general veterinary practitioner in my behavior practice with my practice, the part of my general practice that was a behavior practice, it was a small portion of it. It was maybe like 20%, of the client base and income, et cetera. So, my bread and butter, 80% of it was still in general practice, and we did a lot of preventative, advice for preventing behavior problems and low stress handling. That did help a lot, yet I still would have people who just didn't listen and wouldn't follow. And I was thinking about this as I was talking to another animal behaviorist from a large shelter in Wisconsin as to what got people to listen to me when I would be telling them or suggesting to them, we need to do a heartworm test and put them on heartworm preventative to prevent this fatal disease in dogs. And at first, some people would say things like, oh, I don't know if that's such a problem. Oh, he doesn't have heartworm. I don't see it in his stool, right? They didn't know about the disease, despite having charts and all these things all around. And what I found was the most effective thing was I had a dog that died from heartworm, the case that came in. And the clients allowed me to save the heart and open the heart to show the worms in this dog's heart in a big jar of formalin that sat proudly on a shelf on full display in the exam room. Sounds pretty gory. I had more people look at that and go, oh my goodness, what's this? Even before I even said, now it's time for the heartworm test, or we're giving heartworm prevention. And I said, that's heartworm. That came from a dog that died from heartworm. And the family allowed me to save the heart to educate people what heartworm is. Oh my gosh, yes, that's what it is. Oh, you better do that test, Dr. Foote. We better give the preventative. So a graphic of some sort, I think, would help. And I don't know, I never went that far to actually have a book to show some of the bites or things like this. But I think a lot of times just relating the story, just telling quickly the story of You know, for example, I had another case where, you know, when it came to people insisting their dogs are okay sharing the food bowl, I started to say, yeah, and that's what happened to the Chihuahua who had his eyeball bitten out and was brought in emergency on my lunch hour. And I would just, and people would be like stunned. And I said, yeah, the Chihuahua stuck his head in the common food bowl, and the other dog who'd been growling, who'd been standing there staring in the past, suddenly grabbed the Chihuahua on the head and bit the whole eyeball out. That's how fast this happens. It happened within 5 seconds, just like this ladder of aggression. Happens as fast. So let's not go there. Feed them separately. And that's usually what got people to even think about feeding the dog separately. But I was willing to say that, you know, to actually see their shock on their face. And sometimes I think that's what they needed. I guess it would be a way of them virtually experiencing it. I just certainly don't want them to actually experience it. I'm going to take a look, see if this works on my Facebook, whatever, Facebook Live on things. If I'm getting some comments here, I would love to hear if any of you have found what works for you. You know, this is a common frustration, and honestly, our animals pay the price for it, of people's beliefs and people's, you know, preconceived notions that, you know, just create the escalating problems. So I guess I have to scroll all the way down here. And here I am now. And, oh, I have 3 comments here. Good. Let me see if I could see this. Look, see if this works on my here. Here I am now. Okay, everybody's just saying hi. Okay, hi. One last thing I will make a point about is, you know, talking about confidence, right? And, you know, having good posture and that. Tone of voice is the second thing, how you say something. And so how we speak is important. And if you listen to many young, when I say younger people, you could tell I'm getting old now. When I listen to people maybe under the age of 30, and I don't know if you just heard my statement there. As I was talking, my tone of voice went down. It didn't go up. But what they do is when they're talking, they tend to end it with acting like a question. And they'll say, I really think that you should use this handout. Like their voice goes up. And at the end of a sentence, when the voice raises, it sounds like it's a question. And so if I am making a statement that, you know, a growl is a bite that hasn't connected yet, it sounds like I'm not sure. It decreases my credibility because I don't sound confident. So when you are needing to give, just listen, do this. Record yourself. With all our cell phones, we can do this now. Record how you speak so that you can hear if you're having that tone go up, and then practice with your tone going down. The last thing I want to bring up is, which again is another point that, yeah, you know, gets a little hard at times to do this, but I really feel that when someone knows how important something is to you, then they may really think about that being an important point. All right, so what I mean is, I got the Rottweiler puppy, 12 weeks of age, did a little growl as we lift him off the table after he had his adaptable, he had his baby food. We try to do the low stress handling because he's kind of scared. We toss rewards to the puppy. We tell the client, please come in for these happy visits. Here, take home these charts. You know, we pointed to the wall in the growl. Puppy comes in for its rabies vaccination at 16 weeks of age now. It's pretty much the time course. Now we're fully in the fear period, and we have a bigger dog. This dog now weighs 45 pounds, and he's pulling back because he's coming to the exam room. He won't get on the scale readily. They didn't come in for any of the happy puppy visits. He walks in the exam room. Tech goes to put him up on the table, and the dog does the quick head flip and, you know, just misses actually on biting. He's now growling at 4 months of age. And we may have slapped up the adapter. We said, let's get him on the floor so that he's not as agitated. Maybe we throw a blanket over his head to quickly cover him because we need to get this rabies vaccination in. We said, okay, he's getting worse now. We have to have you come in for these puppy visits. We have to do this. We have to do, you know, I'm requiring you. I'm going to set up the time. And the client never shows. And they don't go to puppy training class, right? They're doing nothing that you're saying. And now it's a year later, and that rabies vaccination is due for the booster. And they've made the appointment for this now 1-year-old Rottweiler to come in, that as you see the dog in the parking lot is jumping up and lunging at other dogs because they didn't get the puppy class and they didn't do the socialization, et cetera, et cetera. And so the dog is agitated as he's trying to come in. And he's you figure, just looking at him, he looks like he's about 120 pounds. And I'm supposed to get a rabies vaccination to this dog safely without getting bitten. And that dog is already so agitated, it's only reinforcing his learning to jump and lunge, etc. No, I don't want to get bitten. I've got 20 other people literally to take care of today. That's not my job or my tech's job to get bitten. We don't have magic wands here. This is all what's going on in your head, right? So how do I say this right to the client? No, I'm not going to do his rabies vaccine right now. Okay, I say that, and even the technicians, you need to say that straight up. Say, hold it, stop, get behind the car. I have to tell doctor how he's acting. Now, of course, as a technician or the nurse, you may use a word, we may not give the rabies vaccine today because of how agitated it is, but you need to say that and be willing to say that and practice saying that. Now, of course, the bottom line runs with me, right? I'm the one that decides really what happens or not. Veterinarians, support your techs, believe them. If they say this dog is going bonkers in the parking lot, first of all, say, what is bonkers? And when they start saying, oh, lunging, biting, okay, I get it now. You go right out to that client and say, we will reschedule this, and I'm dispensing pre-exam medication he is required to take. We will not provide the rabies vaccine today. It is not safe. We cannot safely handle your dog. You have to be willing to refuse care. That's it in a nutshell. Refuse care right then. Now, whether or not you are at a place, a shelter, a grooming parlor, a dog trainer, a veterinary clinic who wants to do the work and has the people with the higher skills for handling these aggressive and highly anxious animals, fine, go ahead and take those cases on. If you are not prepared for that, or you yourself have been bitten or nearly bitten and are in a state of PTSD because of that, even for that reason, I support you in refusing care for this animal and referring them on then to a veterinary staff who has those skills. So this may be that only a veterinary behaviorist can examine this patient. Only someone who has gone through the advanced handling education and that can safely examine this patient in a way that we're not going to make it worse. Now, so refusal of care. For dog trainers, you have the dog who comes into class, right? I know, I hear this. The dog comes into class, it's the 7-month-old Rottweiler who should have been there when he was 8 weeks old, but anyway, he's a 7-month-old Rottweiler. He comes into class, he's barking, lunging, he's carrying on, immediately scooting the dog in the corner, putting up a barrier. And maybe you might say, we're going to give him one class to see if he settles down, but if it's obvious, like he's too agitated, trainers refuse that the dog can be in class. You got to get him out of class. And secondly, again, if you don't have the time, because now you have to do one-on-one training with this dog. It has to be very slowly broken down. Yes, and you should, and you need to charge the higher hourly fee to do this training. That you just say, you can't be in class. No, you're out of class. We're not even going to try because he's too agitated. You must set up for private training, or you must get together with a veterinarian with expertise in behavior to even start the training. Go ahead and draw that line. Same thing with groomers. I see a lot of groomers that may be in a bit of a dilemma. It could be your boss, etc. That, yeah, the dog is matted, the dog is overgrown, and oh man, this is going to be painful on this dog. And the dog is flipping their head as you're even trying to bring the clippers because that's why the dog is matted. He hasn't been in and regularly clipped. We have to support you in saying, no, I cannot groom the dog without the benefit of either some tranquilizer, anxiety reducer, or pain reducer, because it's going to hurt. Groomers, please say to people, it hurts to have these mats down to the skin level and to be, to refuse doing grooming on some of these dogs, or state the only way this dog can be humanely, and use those words, humanely groomed, is under sedation at your veterinary practice. And that's how it is. Again, you stop the chatter, you be quiet in that. You know, some other tips, and I learned these over the years going to a lot of, you know, practice management, you know, business management courses as far as being a veterinarian and a businesswoman, is compliance. Compliance means that someone has agreed to do what you're asking them to do. Here's a bottle of medication, and that client actually takes the medication and gives it to their pet. They don't skip the doses, you know. They actually came back for the recheck appointment. They complied with what your request was, or your, you know, what you're asking them to do. So compliance, in compliance studies, how many times does a person need to hear a message before they will actually do what you want them to do? And this is coming from Karen Gavzer. She's a prominent speaker in the practice management, you know, side of veterinary medicine. And I remember her saying anywhere from 3 to 12 repeats of your message has to happen before this person will do what you want them to do. So it could be making the recheck appointment, giving the hypoallergenic diet, or stopping the children from hugging the dog who growls when being hugged, like actually stopping the children. So it could take 12 repeats for that family to actually get it, that, oh, we want to stop what's happening around the dog so he doesn't go to the bite. So in that case, that's why whoever it is, veterinarian, the groomer, the trainer, the shelter care, the animal control officer, has said the words. That's one message. You hand them the handouts. That's 2 messages, okay? And then you repeat it again, maybe each time you see them, and keep track of that, because you could have somebody that it takes 12 repeats before they'll actually do what you want them to do. So stick with it. I know it's really tough. Celebrate those who take your advice. I think that's the other thing that helped me a lot to not give up on being real straightforward, having these handouts in a little file box. We just whipped them out and handed them to everybody, write the name of the pet on there and so on. What kept me going was when I saw a client say, hey, yeah, you're right, Dr. Foote. Finally, you know, when the dog's laying on the couch, put up the baby gate so the 3-year-old would stop hugging him, and now the dog doesn't growl at the kids anymore. We found, like, yeah, we did that. We found our solution. We did what you said. It's a lot better at home. I would tell them, wonderful, and I would use those words. I mean, I would really praise them for having followed it. Yeah, in a way you think, like, well, I should have done it anyway. But in a sense, they had to change their belief system. My words or whatever, my graphics had to cut through a lot of preconceived notions, and everybody else around them is probably saying things like, oh, it doesn't matter, oh, it's just puppyhood, blah, blah, blah. That my message had to cut through. They had to comply. And so and I would just kind of keep a mental note, well, are they a 3-message person or a 12-message person? Because if they were a 12-message person, now than any other time, when I needed to inform them about, you know, preventative medicine or other things, I'd be prepared for what's going to take about 12 messages to get through to you. Let's just get that out every single time and be a broken record. So thanks everyone for being here. I really appreciate the time you guys spending on this. Tell me your comments. Email me and tell me what words work for you. I have a lot of the handouts. I have the ladders of aggression. I have the top 10 ways for pets and kids to stay safe together. I have a lot of handouts under my free resources on my website under both the veterinary tab, and there's some different ones under the pet owner tab. Print those off, keep them in a file box at your shelter, at your animal control facility, your grooming parlor, pet owners, share them with your friends, whatever, and hand those out right and left. You can use them if you do a newsletter for your own business. You have permission to use them if they're coming off of my site, you know, under the free resources. I also have a lot of videos on my YouTube channel. Make sure to subscribe to the Dr. Sally J. Foote YouTube channel. And you can also put links or send those off and, you know, put them in newsletters or just play those in your practice or your waiting room or whatever to also help inform people and that. So thank you, and I look forward to next week.